So next myeloproliferative neoplasm is the essential thrombocytosis. So in essential thrombocytosis, as the name suggests, there is going to be thrombocytosis. So platelet counts is going to be elevated more than or equal to 4.5 lakh. So normal count is up to 1.5 to 4 lakh. So here the count is going to be more than 4.5 lakh. And in the bone marrow, if you see, there is going to be megakaryocytic proliferation. Only in polycythemia vera we had panmyelosis. So in thrombocytosis, it is just the platelet which is going to be elevated. Only the megakaryocytic proliferation is there. And the characteristic mutations here is the JAK2 mutation, calreticulin mutation, and then MPL mutation. So JAK2 is common for all three, which is essential thrombocytosis, PCV, and primary myelofibrosis. But along with that, in essential thrombocytosis and then also in primary myelofibrosis, you are going to have calreticulin and MPL mutations. JAK2 is the most common mutation here. So clinical features, if you see, the patients are going to present with something called as erythromelalgia. So erythromelalgia is nothing but burning sensations, burning and a pain kind of feeling you will see in the feet and the hands. So burning sensation along with pain in the hand and foot is called as erythromelalgia. It is actually because the increased platelets which are formed, right? So they are going to go and clog the small arterioles. So small vessels are going to be clogged. So because of that, the blood supply is not coming to the peripheries, and that is going to result in the pain. So erythromelalgia. So next myeloproliferative neoplasm is the primary myelofibrosis. In primary myelofibrosis, if you see, here again, there is going to be proliferation of the megakaryocytes only, but along with that, there is going to be atypia. So only proliferation seen in both essential thrombocytosis, polycythemia vera, and also in CML, but along with atypia, it is only present in primary myelofibrosis. So the atypia will present as cloud-like nuclei. So in the megakaryocytes, it is usually a multilobated kind of a nucleus, right? But here the multilobation is not there, and it is kind of looking like a cloud. So vaguely lobation is seen. So cloud-like nucleus is characteristic of primary myelofibrosis in the megakaryocyte. So here the megakaryocytes are proliferating, right? So already I mentioned, whenever megakaryocytes are proliferating, they are going to result in fibrosis. Why? Because they are going to release PDGF and FGF. So because of this is why the term primary myelofibrosis had come. So CML, PCV, and ET, all the three can result in primary myelofibrosis in their spent phase. So because there is fibrosis, in the blood picture, if you see, there is going to be a leukoerythroblastosis. So leukoerythroblastosis is nothing but immature WBCs and RBC precursors present in the peripheral blood. Normally, we don't see immature precursors in the peripheral blood, right? So in this picture, there is going to be leukoerythroblastosis. So myelocytes will be present, metamyelocytes are going to be present. Apart from that, you are going to see nucleated RBCs in the peripheral blood. So that is called as leukoerythroblastosis, which we has again a classical finding in PMF. So there is fibrosis. So once there is fibrosis, there is going to be teardrop cells. Teardrop RBCs are going to be there. Okay. So they are coming through this fibrosed thing. So it is going to form a teardrop kind of a morphology. So teardrop cells are again seen. So if you see in this image, these are all the teardrop cells. So you are seeing multiple teardrop cells. Apart from that, this is an NRBC which we see here. So there is a pinkish kind of a cytoplasm, and apart from that, you are having a very dark kind of a nucleus. This is an NRBC here, and then you are going to see this kind of myeloid precursors. So this is all a this is a band form here. This is a proper neutrophil here, but these two are going to be, this is kind of looking like a myelocyte. This is looking like a metamyelocyte. So it is a leukoerythroblastic picture along with teardrop cells. So this is a classical image for a primary myelofibrosis. And whenever there is fibrosis, obviously when you do a bone marrow aspirate, it is going to yield a dry tap only. So already I told JAK2, CALR, and MPL mutations are common for both ET and primary myelofibrosis. So now we are done with myeloproliferative neoplasms.